This talk is about how to complete a medication trial history in psychiatry. A medication trial history is the history of what psychiatric medications a patient has tried in the past. This should include at minimum 6 components: length, max dose, adherence, efficacy, side effects, and discontinue. Length refers to the longest duration the patient tried a medication. Max dose refers to the highest dose of medication that was tried. Adherence refers to whether or not the patient took the medication correctly as prescribed. Efficacy refers to how the patient's symptoms were affected by the medication and if there was any symptom improvement. Side effects refers to any adverse side effects of the medication, including any harmful or potentially dangerous effects. And discontinue refers to the reason why the medication was ultimately discontinued or stopped. This is the usual order in which I like to ask these questions, but if we rearrange these items, then we get the helpful mnemonic medals. If you want to earn a medal for a thorough yet concise med history, then ask about medals. Why is it important to get a detailed med trial history? Well, it's to inform future medication decisions and to make sure that prior medication trials were adequate trials. Remember that an adequate trial involves treatment with a medication for an adequate length, at an adequate dose, with adequate adherence. So, an inadequate trial would involve not treating for long enough, not using a high enough dose, or not having good enough adherence. If any of these factors are true, then it wasn't an adequate trial, and you can consider trying the medication again. There are legitimate reasons for discontinuing a medication, including if the med was ineffective, if it was intolerable due to side effects, or if it was unsafe due to a harmful side effect. However, there are also plenty of reasons why a patient might prematurely discontinue a med or might be non-adherent to meds. These include demoralization or impatience due to the delayed efficacy of many psychiatric meds, difficulty with taking a complicated med regimen, prohibitive cost, distrust in the doctor or med, fear of harmful side effects, or simply a preference to not take medication, among other reasons. It's important to find out these reasons, so you can help fill any knowledge gaps and make informed next steps in treatment. This is the key information to obtain when gathering a medication trial history. Let's conclude by going through some examples of medication trials and how to document this. For each example, we'll include the trial length, max dose, adherence, efficacy, side effects, and reason for discontinuation. I'll particularly highlight the result of each trial, that is, whether it was ineffective, intolerable, unsafe, an inadequate trial, or whether it was an effective trial. For the sake of example, let's say we're working with a 25-year-old patient with major depressive disorder. The first example is escitalopram, which was tried from March to June, about 3 months, achieved a max dose of 20 milligrams, adherence was good, but the medication was ineffective and had no side effects. Therefore, this was an adequate but ineffective trial, and was discontinued for a legitimate reason. Next is venlafaxine, which was tried for 2 weeks at a max dose of 75 milligrams, with good adherence, but caused an intolerable side effect of excess sweating. Therefore, this was an intolerable trial, and was discontinued for a legitimate reason. Next is duloxetine, which was tried for 1 month at a dose of 30 milligrams with good adherence, but was stopped after only 1 month due to the patient's preference. Therefore, this would be considered an inadequate trial, as neither the duration or dose of medication was adequate. Next is amitriptyline, which was tried for 3 weeks at a max dose of 100 milligrams with good adherence, but caused a potentially dangerous arrhythmia. Therefore, this was an unsafe trial and was discontinued for a legitimate reason. Next is bupropion, which was tried for 2 months at a max dose of 150 milligrams with good adherence and caused some increased anxiety, but was effective for the patient's depression. The patient felt this side effect was tolerable, and since it had an effective response, this could be considered an effective trial. For some patients, they would be content to stick with this medication, but let's say they wanted to give duloxetine another try. This time around, the patient tried the medication for an adequate length, 2 months, at an adequate dose, 60 milligrams, and found that the medication was effective without side effects. So ultimately, duloxetine was also an effective trial and was superior to bupropion since it did not have any noticeable side effects. This is a good illustration of why gathering a detailed medication history and understanding the concept of adequate trials is so important. If we had completely written off duloxetine as a failed trial, then the patient may never have tried it again and had this better outcome. Finally, here are some examples of how I would document these med trials in the medical record. That's the end of this talk. I hope this is a useful guide to taking a medication trial history. Thank you.